Hi, everybody. Welcome to the Insider Series. We're happy to have you this afternoon. I'm Peck. I'm a managing director with Valenta and really excited to talk to you all today about a big topic. And the topic we're talking about today in our Insider Series is really about healthcare operations and what the pain points are and what the key for automation will be in the sector today and moving forward. So it's a big question. There's a lot of challenges. It's a very deep field in terms of what we can talk about. So we're going to try to keep it relatively into one space and really dive into some of the solutions at hand. But before we do that, I just wanted to have a couple of housekeeping items. We do have a live chat feature open, so please ask questions as we're going through the topics and you have questions or things come to top of mind, please type them in. We will wait until the end of the dialogue to have a question and answer session, and we'll try to get to every question that is posted. Also, if you have to drop off or if you joined late, then a recording will be sent to you via email following the conversation. So with that being said, and without further ado, I would like to introduce our guest today, who's a partner of mine. I'm very, very happy to have him speaking on the panel today. So a little bit about Shan Mukundan. So Shan, as a physician by training, has been an accomplished motivational leader in the healthcare industry over the last 2 decades. He has a proven track record of achievement in creating efficient processes, empowering continuous process improvement, and leveraging digital technology and improving outcomes and cost. Shan has an extensive history of success in healthcare, leading teams of people with complex arrays of responsibilities to boost efficiencies and performance. Most recently, Shan was the National Medical Director at Aetna, a Fortune 500 company, overseeing large, accountable healthcare organizations across the United States. Prior to that, he was the Chief Medical Officer for a large regional health network in Arizona, managing 1,000 primary care physicians and 5,000 specialty physicians. He's got a proven track record for analyzing root cause and problems, restructuring systems, and successfully implementing solutions within complex hospital systems. So Shan, now that I'm done embarrassing you, welcome. And it's great to have you with us today.
Thank you, Alan. I'm excited to be here to have this really important conversation.
Awesome. Hey, Shan, maybe just to kick it off, just a big, broad question. It's been a really different time in the healthcare, especially in the last couple of years. And the normal pain points that have been out there have been exacerbated. People have been scrambling day after day to adjust to new protocols, staff shortages, all sorts of things. So maybe if you could take a physician and a chief medical officer's perspective on, where we are in healthcare, what some of the biggest challenges are and the pain points that you've been encountering, just to get things started, that would be wonderful.
Great, yes. As you know, healthcare has been going through a rapid evolution in the last couple of decades. We have a very finite force of healthcare providers taking care of growing, aging population, along with a highly high prevalence of chronic diseases as well. So the prevalence of chronic diseases is going up as well. So that's definitely has caused, even prior to the pandemic, a significant burnout and stress on the healthcare providers and the healthcare networks, the healthcare systems. And the pandemic sort of threw a curveball into it and made things a lot worse. And I think what pandemic did is not only introduced new protocols that they have to adapt to, new methods of engaging patients, of running practices, along with, I think the biggest challenge has been the staffing, where people are getting burnt out or either leaving. So retention and recruitment has both been a big challenge. So all of that, I think, it's already a complex system, the healthcare system here in the US, and the providers who are really bearing the brunt of it, especially, I'm today going to be more focusing on the medical providers on the ground. And they are really at this point stressed quite a bit, and physician burnout is a real crisis at this point.
Yeah, thanks, Shan. So when we think about that, I mean, I know you're focusing on, the individual providers and the practices that are customer and patient facing. but would you say there's similar parallels to supergroups and to larger organizations and to health networks as well?
Yeah, I think large medical practices, large supergroups, and even independent physician networks, which I was a CMO of in the past, um, they have a much more of a challenge because they're not as nimble as a small practice. So when they have a curveball thrown into their system, it takes a lot longer to adjust, and then the pain that they have to go through, the growing pains that they have to go through is much longer. So obviously, they have gone through a lot more of the stress during this phase during the pandemic, for sure.
Awesome. Hey, so we know that there's been a huge staff challenge, finding labor, retaining labor, training people, and having not only just great healthcare in general, but also trying to enhance patient experience, which was really pre-pandemic what a lot of practices were focusing on, and then it just pivoted to triage and how can we actually see people. So maybe we'll just begin at what you've been talking to practices about in terms of finding people and having reliable solutions in a cost-effective manner.
Yeah, so when you talk about a practice or a large supergroup or even healthcare organizations, the biggest challenge in healthcare is, as I said, the pandemic, especially now, has caused a lot of hesitancy for folks to enter the industry to work. People who have been there have been overworked, stressed, both physically as well as there's also been a moral stress on them with this pandemic. And so that's caused a lot of people to reset and exit and look for other opportunities. So that's definitely a big factor that's affected all the healthcare organizations, small or large. But other factor I think that also is very important that we need to realize in healthcare is the pricing that we the healthcare providers or the organization do not have a lot of pricing power as far as the staffing is concerned because their reimbursement is regulated and capped. So that again adds a lot more stress as well to the existing system that's in place. When you have additional recruitment and retention struggles along with that, that just exacerbates the staffing situation.
Yeah,
So
no question. Go ahead. I'm
yeah,
sorry,
to
Shan.
your question, I think you asked me, so when we have a conversation, this is typically what we face when we have a conversation with the medical practices. The biggest challenge for them while they are facing this struggle is really the time that's spent on constant recruitment. That's actually a sunken opportunity for time. So the management is most invested in continuously recruiting staff and onboarding. So there is sunken cost on recruitment and as well as onboarding that keeps happening perpetually. And that's become a big challenge for them as well. So it sort of spills over to the other operations as well because of the time that's consumed in this process. So that's something really affecting these organizations, and that's what I hear when I talk to them about staffing.
Yeah, I mean, it's a huge challenge, and that puts, again, to your point, a big strain on the entire process within the walls of every building. So maybe let's talk and pivot a little bit towards what some of the solutions are, because in today's environment, it isn't just throwing a human at a solution, where it certainly can be. It could be very often a hybrid solution, and that's one of the topics we wanted to talk about today is how automation comes into play into some of the solutions that we're facing and staffing and patient experience and just generating quality healthcare to patients. So maybe we'll just start with how do you start? What is your approach? Because not every practices has the same challenges, right? So how do you begin having a conversation around identifying what the root cause is, the real root cause, and then what are some of the different directions you can take in terms of bringing solutions to them?
Yeah, I think that's a very good question because a lot of practices understand that they have an issue at hand, and typically they have been focused on just serving the patients when they come to the office and sort of keep the fires out for most of the time, and therefore they know what the issues are, but not really able to identify what the drivers are, what could be the solution to the problem. So I think the key to that is to really start looking at, okay, what is the process workflow that you have in your office, or you ought to have in your office? So start looking at process mapping. I think that's critical. Let's say the solution for staffing is to get a virtual staff. For example, you're not able to hire a medical assistant all the time, but some of the work can be virtualized. Some of them have to be on hand, high touch with the patient. That virtualization of that job can be done only when you have a workflow that's clearly laid out, so that it can be shared and executed with consistency and reliability. So I think that's something, once we go and talk about issues in the practice, is we quickly realized, yes, we do have a workflow, but we need to formalize that. We need to create a playbook for each employee in the practice. Their role is well defined so there's no confusion. A lot of times that actually helps a lot, just reducing the confusion and the things that are falling through the cracks. And we don't want that to happen in patient care. So I think in a lot of ways, we think automation is robots and technology, but I think just doing a process mapping and being able to create a workflow that can be replicated reliably is sort of an automating process. I think that's sort of the prerequisite and the first step towards automation, be it if you want to use a human to do it, or if you want a bot or a AI tool to be able to do that for you.
Yeah, it's very interesting. So if you standardize your system, you have best practices, you have roles, responsibilities, SOPs in place, then you can do a lot more than if you're just trying to just plug your fingers in the dam where it's leaking and not really have that systematic approach. That's an interesting solution. What are some of the ways that you've thought about automation in the practice? Just getting data to providers, to help them be more efficient with patient intake, with flow in the practice, with organization of digital records. I mean, where's your head been around those challenges and the solutions you can offer them?
Yeah, so there's been a few practices where we actually have deployed some of these, and so it's I would probably want to segment that into a low-hanging fruit that's really a pain point for a lot of practices. They get a lot of electronic document dump into their practice, and then they have to subsequently index it based on which patient it belongs to in the chart in the electronic health record. So that is a very tedious manual process and a lot of practices, and that can be easily automated. And I think that's one of the things that we have worked on that can actually take away, and a lot of employees don't really like doing that kind of menial work. So, and I think that's a key in some of these automation, is to actually enhance this employee satisfaction. And we would like to call it more a staff augmentation tool. So that's one area that we have worked on, where there's an opportunity in medical practices and healthcare organizations where automation can really be helpful, is document indexing. That's a real need to make sure that when a healthcare provider is taking care of a member, that they have everything categorized in the right spot, and that actually relates to how the care is eventually delivered. So that's one area. The other area, as you pointed out, is for a long time, medical practices and providers have been sort of subjected to data sets coming from the outside on their own members, on their own patients that they are taking care of. But actually, the source of truth lies in their electronic records, and they have never been empowered or have the tool to be able to develop their own data set. So with our bots and our automation technology tools, we can definitely create dashboards out of their own EMR of with the data sets that actually makes clinical sense to the provider, and that would give them insight into the clinical problems of their patients. So actually the care will be better, but at the same time, it also empowers them to have a much more effective conversation with the stakeholders. So they are the power dynamics becomes a little bit more balanced in that sense. So I think with the value transition that's going on, value contracts that's coming out, I think empowering these practices, I think, would be a critical part of preparing them to be able to deal with the future in healthcare.
Yeah, that's great. It sounds like a win-win-win. You take mundane tasks away from people to enhance their employee satisfaction, which hopefully gives you better retention. You get documents in the right places in a more efficient and time efficient manner. And you have data to be able to treat your patients much more rapidly as well. So great. So, hey, Shan, just a couple things strike me when I'm thinking about one, I can go down the automation path, and two, I can go down, maybe just describing, for people who are listening in who haven't had any experience with virtual staff, could you maybe explain like how a virtual medical assistant or a virtual scribe or one of these people actually integrates into a practice? I mean, how do you do that? And what's best practice in your experience, Ben?
That's a great question. You have to live through that experience to really comprehend that. But I know almost all providers can identify how that is actually a need that they want to be met. All providers are going through, especially the physicians and the mid-levels, they call that the pajama time, that they take care of the patients in the office, and subsequently they still have to do a lot of record keeping and documentation post workday at home in their pajamas, and that takes 2 to 3 hours for a lot of people. I mean, that's why physician burnout is real, and describing is a great solution for that. So the way it would work in the case of virtual scribe is that they would be seamlessly in tuned with your computer, listening into the conversation while you are conversing and examining your patient, and be documenting while you're having the conversation in the chart. So it's happening in real time. And once you are done with that visit and you're coming out of the room, you do a quick snap, like a 30-second or 20-second conversation with the scribe and saying, this is my plan of care. Because documentation alone is not what happens, but also it's like what lab tests, what imaging that need order, and referrals. And so a lot of those paraphernalias. And imagine if you're seeing 25, 30 patients, at the end of the day, to keep track of all of that in your head and to be able to do that without an error is a big burden on the provider. So being able to execute that real time is really handy. And makes your life so much better. So I've seen physicians pajama time convert from 2 hours to 5 minutes. It's been a blessing, and I don't think anybody has got a point. Once they have it, it's a point of no return. Nobody goes back. It's like they become really dependent on them. So that's how it really works with the virtual scribes. It's a lot more effective than people having scribes in the office. It's not as intrusive. It's a lot more cost effective, and they can also, be able to do other functions while they're not physically distracted in the office. So that's how the virtual scribe works. Virtual medical assistant is again a new creation to meet a need, essentially because staffing is a challenge, recruitment is a challenge, turnover is a challenge, and the reality is a medical assistant is out there in the room, mostly doing vitals, recording stuff like med record and medication list and so forth, which is all needs to be done with patient interaction in real time in their presence. But a lot of the other activity that happens in the background, calling back, conveying messages back and forth, getting pre-authorizations on medications, because there's a list of medications and procedures that we have to get up insurance approval on. And I know in a medical practice where we have deployed this, where a physician will go into the office and realize, hey, you don't have your x-ray image that I wanted to for this visit. She will message the virtual medical assistant real time, and in 5 minutes she calls, gets a record, puts it on the chart, and she has it before the visit is done. So that's been a game changer for a lot of these practices where somebody being able to do this in real time and effectively making the visit a lot more efficient, it's fabulous. That's clearly a display of how it can impact outcomes on patient care. So that's typically how that works. So it's the staff who are in the office are not essentially distracted by all of this while they're actually handling a patient. So they are loving that as well. So it's actually improved employee satisfaction. The teamwork has been tremendous, even though it's virtual. It's a lot more seamless sometimes if it's virtual. So that's sort of been our experience with these virtual staff, and that's typically how it would work in real time in a practice.
Awesome. So if I'm hearing you right, you can have great patient experience with reliable staff in a cost-effective way without having extra people in the lane to get it done. So it sounds like a win-win. Another direction you can go is automation, right? Because as we talk about AI, it's a very in digital transformation strategies, it's a big field, right? But when you look at the medical side of things, you think of things like conversational AI and multi-channel and omni-channel approaches to medicine. And I know that at Valenta, we kind of have an internal mantra that whatever we can't automate, we have virtual staffing to complement. And I just, I think about, with economies of scale and bigger providers, integrating conversational AI, where a lot of this virtual assistant can be done by a bot. It probably is a little bit more expensive way to get started, but at the same time, for people who have existing call centers already, for people who have dedicated digital assistants that are doing this all the time, it may be a very viable solution to having 24/7 coverage, especially during pandemic times. I mean, any experience with that, Shan, when you're working with larger healthcare providers in terms of their success with that?
Yeah, I mean, my experience at Aetna and other healthcare organizations today, I think to really influence patient behavior and engagement, we know that nudging is an important aspect of making sure we get the outcome we want, making sure the patient is getting the healthcare taken care of that you're supposed to. So there are different, we all are, we have different psychological profiles. We need a different level of motivation to get our health taken care of. As we have, generally putting there, either we are orchids or we are dandelions, right? We are either seeking healthcare or we just think we are invincible. So there's a lot of people in between, but everybody needs a different nudge. And I think that's where the conversational AI becomes critical. It's part of the omni-channel route of providing that nudge to the member or the patient. Be it a small practice, be it a large organization, there's a real requirement for nudging the patient to get certain care taken care of. Making sure, if let's say it's a nursing home, making sure that the member actually goes and sees a primary care physician after their discharge, maybe providing a nudge to make that happen. Typically, emails or text messages is what we use. A lot of times we know in certain personalities, certain folks, it doesn't work. And people are also sometimes technologically challenged in the sense we have portals for every practice. We want to get a survey. People are really hesitant to go and click on the link and follow through. It becomes a lot more easier if a conversational bot is guiding you through the process. It's more like a hand-holding. And especially if you're technologically challenged, that becomes a lot more handier and makes that much more possible for it to happen. So I think that's going to be critical, the conversational AI piece for patient engagement, either to make sure the care they're getting, they're supposed to, or, we're talking about patient-reported outcomes. That's going to be very important moving forward, be it for how does a surgery work for a member, or how does medications working for a chronic disease. We're all moving towards that. So we have to figure out a way to engage the members more effectively. And I think, if not today, for tomorrow, conversational AI is going to be a necessity. So I think it's better to get on board now than later. That's my thought on that. And automation on a whole, I think, is important, and it's actually would meet the needs of the members and the practices today, but it will be a necessity tomorrow.
Yeah, that's great. That's great feedback. One of the things that I get, I've also worked with healthcare providers for a long period of time, and sometimes when you get smaller practitioners or medium-sized businesses and practices, they feel that there aren't solutions that are their size, and that a lot of these things are only for the bigger practices and super groups and private equity firms that have a lot of money to spend on these solutions. What would your response be to those? Because you've worked, from Fortune 500 down to, solo practitioners and smaller groups. What would your response be? Because I'm sure you've had that conversation many times.
Yeah, I think, I mean, if technology solutions sometimes works for enterprise level, and I think it's at the what phase that technology is at on the curve. Also the complexity of the technology, but the solutions that we provide at Valenta are very customizable even for small practices. And I think that's the great advantage in our organization, that we have the ability to be able to cater to small to medium to large and customize it. And I think the key is to be able to let them customize the solution to what meets their need. I think that's the key. The reality is, and I think I would say this, automation has to be cheaper than the cheapest human available to do the job. And either you have that person who can do that job for that lower price, or you may not have that person for that particular skill set. And I know there's certain skill sets that, for example, creating a dashboard or data set, we can't have a humans effectively do that as efficiently as a machine does. Maybe today we have people who can do some of the indexing of the documents, but we have to be sure that you have to have this in mind, that the labor market's always never constant. It changes. And the way the workforce is shrinking, especially in healthcare, and the demand's going up, it's only likely that we will have at some point soon no other solution than resorting to automation. So that's sort of what people used to say for healthcare before. You better jump off the boat before it hits the waterfalls, or you're going to end up there. So I think we are heading towards where automation is going to be a necessity. So yeah, I mean, I think at this point, you got to be judicious. How do you use it based on what your needs are? But it's definitely a solution that's going to be mainstream very soon.
Awesome. Thanks, Shan. So yeah, just offering, just to summarize a lot of things you've said. I mean, it's, take a consultative approach, listen to the challenges and needs and try to provide customized solutions, be it automation of any type, staff augmentation, or a combination of all of the above, to make sure that that whole patient experience and that workflow continues in a healthy manner, because medical practices need to be healthy as well to continue treating patients. It's hard to believe that a half an hour flew by, but it did. Great conversation. Maybe we can move into a little bit of Q&A for the next 15 minutes or so to answer any questions that people are thinking about and would like to have some answers from you on today.
Great. Thanks so much, Alan, and thanks so much, everyone, for joining today. So we do have a few questions that I'll go through. One just came through from one of our audience members in the Zoom chat from Stephen. And his question is, getting a medical healthcare professional to think in terms of process mapping would seem to be a challenge. How do you nudge a professional to see the limits of their background and be receptive to the process expertise? I know that's kind of a big one, but a good one. Shan, go ahead.
Yeah, that's a great question. Definitely, yeah, if you're walking into a medical practice and then you are trying to fathom their issues and then trying to give them a solution that possibly can work for them. And then part of that solution is to really figure out what exactly is going on in the practice and what exactly should be going on in the practice. And I think a lot of providers, you'd be surprised at how many of them have an intent to do what they want to do, but they just don't have the time. And I think it's important, to validate that it's not that they don't have the skill set to do it. It's just they don't have the time to do it. They have the intent to do it. You will realize that very soon when you interact with them. But you will soon realize that just they don't have the time, and they will be so happy that you would be doing all that Scott work for them to realize their intent that they had in the original place. Their intent's always been to have everything sorted out, and they're just running from patient to patient in their life, so that they have never gotten to do it. So that, yes, it might be initially might be a pushback, but you'll soon realize that they actually do want the solution, as long as you validate them for what they're capable of and what they've been doing and how they can do better. It typically works.
Thank you, Shan.
I agree with that, Shan. I'll just add, just a brief point. They have to be motivated to do something different as well. And, that's a key thing to understand. Do they have the ability to implement change? Because their time constraints sometimes don't match their ability to lead. And but I will add that, Shan, you're absolutely right. When you speak to the healthcare provider and understand what their challenges are, and then you go in and see it happen, all you have to do is follow a couple of patients through the process and see how that flow works and see what the staff responses are. It tells the entire story, and you can easily summarize with them in a very positive and holistic approach, and start a really productive dialogue.
One more thing I would like to add is that a lot of times you realize it's not the physicians or the providers who are actually going to push back. It's going to be the office managers and the administrators, because typically it means more work for them. But in this situation, we're actually solving their problem. So when I used to be a medical director, it was a different interface compared to now. When I go in, actually, I am their friend. So it's typically the administrators that you got to win over. The physicians usually want things done. And so I think our solutions actually solve problems on both ends. So actually it works.
Great, thank you both. I have a question from Richard from the audience as well. Would you mind talking about HIPAA and data protection aspects and concerns? I know this is US kind of specific, but can talk about maybe privacy in general.
Sure, yeah, and I think that is a very valid question, especially when you're using virtual staff or a automated process or a bot that's getting onto the system. We do have a very robust process of NDA and HIPAA agreement and HIPAA training that our staff goes through. So we try to meet all the requirements that we need to meet for HIPAA and privacy protections at the facilities where our folks work. Make sure that they go through the HIPAA training process, get the HIPAA certification, and then we do have an agreement with all the healthcare entities that we deal with, where we sign a HIPAA and an NDA agreement, making sure that we protect the confidentiality of the practice and the members that come to the practice.
Anything else to add, Alan?
Yeah, I'll just say from the automation side, data security is paramount, right? And, as an organization, that's, the #1 priority that we have all time. So you'll see ISO certifications, beyond the need to help validate that piece. But also, when we're employing robotic solutions, most of the time they reside on the customer secure server as well. So there is not a need to have a third-party intermediary between the customer, the patient, and the provider. So it's a very high level of security. We will do what the provider wants to have in their greatest ability for the highest level of security possible. It's definitely one of the most important things. And if you look at the cost of retrieving bad data problems, it's astronomical, and we certainly don't want to get pulled into that piece.
Great, thank you both. I have another question from Stephen. Although pain points may be both in administration or administrated and in direct patient care, Is not the opportunity set on the administrative side? Wouldn't physicians or healthcare professionals resist changes to the process of direct patient care? That's a good one.
I would think that's what we would want. But as you know, we made the healthcare system a lot more complex than we wanted to be. So there are so many layers of regulations. So let me give you one example, billing. And I think we didn't specifically talk about that, but that is a pain point for a lot of healthcare organizations because they have to bill, like unlike any other industry, they have to bill for a service that they have provided and get paid later in time from either insurance company or the Medicare or Medicaid. And the way it works is that each organization has their own billing system. A lot of them are legacy system, and they are not actually incentivized to change or modernize. So you may have a very modern system of billing, but you're all constantly butting against legacy systems, and so you have a lot of collaterals that happen because that's not controllable, and you got to deal with it. And unfortunately, some of these are so stuck and structured that is, at this point, at least in the immediate future, not likely to change. That we just have to find solutions to play in that box, and that's been mostly the rule of the game in healthcare. Is like, how do you play in the box that's been built for you, and how do you get better at that, and how do you get ways around to make it as efficient as possible. So that's sort of an illustration of how you have a rigid structure that you got to work within, and find innovations to help you sort of be able to manage through those challenges.
Yeah, and I'll just add one thing to that, because I think what Steve, Steve, to answer another part of your question, I think when you're talking about large corporate entities, a lot of times it is top down, right? It's being driven by administration down through the organization, and the people at the bottom are the doctors, and they just want help, right? So if you can provide, systems for the administrators to, number one, help their physicians, and number two, be cost efficient, then it's a win for both, and it's embraced. And in private practices and privately owned practices, a lot of times it's bottom up, or it's the entity itself that's owned by the physicians, and they want help as well because they want their bottom line to be healthy. And so whatever you can do to become more efficient, create a better quality of life, reduce physician burnout, is truly a partnership and a gift that they will appreciate.
I mean, yeah, I think maybe Stephen also is alluding to an employed model, not essentially an entrepreneur model. And an employed model, it is in the employer's interest to make sure that they have retention, because they are going to be dealing with staffing crisis for sure. And I think some of these technologies is going to really benefit them to be able to engage the employees better and making their life better as well. Virtual scribes is one of them. Having a virtual assistant to be able to streamline things for them while they are taking care of the members. So I think there is a real opportunity of improving the quality of life of their employed physicians and building resilience for them to stay longer and be able to thrive in the practice.
Great, thank you both. I have another question from the audience here from Venkesh. How about care and coordination issues in ambulatory care? Is there any existing technology?
Care and coordination that's beyond the office space where the member is at. There are a lot of platforms out there which can help enable the care coordination to happen a lot more seamlessly. Today, there's a lot of, like for a physician in the office, if they want to coordinate care for a member for care outside the office, it's a lot of phone calls and phone tags and document faxing, and you never know things happen. But there are platforms that are coming up. That's not part of our solution, but there are technology platforms that are coming up that are going to make that a lot more seamless and easy. But a lot of times that falls into the accountable care organization or the insurance companies to be able to coordinate that for the practices. The solutions that the pain points we are talking about are more so of how you are effectively and efficiently taking care of them while they're in the office, and also to be able to engage them in the care that you are providing. I think one of the things that we can help with the virtual staffing model is to be able to coordinate the referrals and the testing that needs to be done. They can actually act as patient navigators virtually, and a lot of practices are starting to use them in that role. And that certainly helps make sure that it's not only the doctor gives a plan of care for a patient when they show to the office, but also make sure that actually is happening out in the community. So yeah, patient care navigation is something a virtual medical assistant actually can provide.
Great, thank you. I have one from Gary from the audience here. Does Valenta have an interface between modern and legacy systems?
Shan, I'll take that one maybe to kick it off. So the answer is yes. And the way we do it is we are really software agnostic, right? So we have developers who will work with existing systems and and create solutions and interfaces between the two of them. So we are not software designers. We do have software developers who will work with the legacy product and interface it into newer technologies, or we may take the approach of consulting and looking at that legacy product and just understanding, what are the limitations, what are the challenges? Is it time to convert over to something that's more reliable and more technology driven in today's world, or is it more cost effective to create a digital bridge between those two things in the short term while you change over to a whole different EHR system or ERP system as well, whatever the case may be. But that's one of the things that we'll do, Gary, is we really will take a very holistic approach on the consulting level, and we have Big Four trained process consultants and digital consultants that can really take in the project, and we're not going to make an assumption and say you have to do this or you have to do that. We'll try to figure out what the best solution is for you.
Great. And I actually have two more from our LinkedIn Live, which is going on at the moment as well. Can dental offices benefit in the same ways, or are there differences?
Alan, you want to take that, or?
Yeah, well, it's interesting. I was just in the dental office yesterday. Yeah, there's no doubt. I mean, there's, so when you look at dental practices, we can do a lot with automation of medical billing. There's no question about that piece. That's a big pain point for them because dental payments are all over the map. So if we can help them automate that and help with the revenue cycle management, that's a huge gain. There's a lot of things you can do with RPA, like, just medical ordering processes, right? And reorder processes as well. To Shan's point earlier, just taking, if you've got a referral dental practice and they've got all the digital imaging coming in from the other practices, we can help get that into the right place in their computer systems. There's a lot that can do. I will say that some specialty dental practices, I was with the endodontist yesterday, so their patient workflow is not quite as high maybe as a general practice would be. So their needs may differ than some other general practices that have just a higher patient workflow every day. But yes, there's a solution to every problem. And I've always taken the approach that there really isn't a practice that we can't help in some way.
I'd like to add on to that, Alan, is that the dental practice, I just want to make sure that we highlight that they're definitely a little different than what a traditional medical practice would be. They don't have the same pricing pressures that a medical practice does. And so actually, in my view, dental practices we have a much bigger opportunity than what we would have in a medical practice, as far as patient engagement through AI, as far as supply chain management, because you do a lot of supplies, it turns over very fast. It's a very procedure-oriented field, and that can be automated. So there is, I think, a lot more opportunity, less price pressure, more affordability. So I think they might be better in a different curve to jump off this bandwagon than the rest of the industry might be. So that's my thought on dental practices.
Great, thank you both. I believe we're at time now, and I'll just pass it back to Alan to close today's session.
Yeah, so thanks, Amanda, the voice of the Valenta behind the big V here. Thanks for hosting the webinar. Shan, it's been a pleasure. Just to wrap things up, you will have a copy of this sent to your inbox. So if you wish to view this later, if you weren't able to listen into the whole thing during the end of your workday, then we will be sending that off to you. If you have any questions, please, you'll see this information on the screen. Reach out to Shan and schedule some time to review your situation and ask questions and find out what our solutions could be for you. So again, to the audience, thank you so much for joining. We know you've got a lot of alternative things to do with your day. We hope you found value in what we talked about today, and we're happy to answer any further questions in additional insight series that are upcoming every 2 weeks. Thank you, everybody.